It's role play number 1 for medicine. Please start preparing now. Thank you. The role play will now last about 5 minutes.
Okay.
Don't worry if I stop you when the time is up. Can you start the role play now, please?
Yes. Hi, my name is Dr. Preeti Tripathi. I'm one of the doctors at this medical center. May I have your name?
Certainly. My name is Sarah.
Nice to meet you, Sarah. How can I help you today?
Certainly. Well, I've been feeling really tired recently, and I had a heart attack, a mild heart attack 2 weeks ago, and I'm just concerned about, you know, what this tiredness might mean, and also what my heart attack might mean for my future.
Okay, sorry to hear about it. Could you tell me, like, what is worrying you? And, like, could you tell me, like, any symptoms particularly that is worrying you? Yeah.
Well, at the moment, it's just this tiredness. You know, it's hard to kind of get going in the morning, and I'm just worried that, you know, this might be something permanent and I might be tired all the time. I'm just really worried that, you know, my life might have changed completely.
I completely understand your concern. I would like to tell you a little more about this acute myocardial infarction. Heart attack actually is a condition where the blood flow to the heart muscle is abruptly cut off. That leads to the tissue damage. So the symptoms could be like heaviness in the chest, nausea, vomiting, jaw pain, back pain. So I can understand your concern. So this tiredness, it usually takes some weeks before your full energy returns. So it might take at least 2 to 3 weeks, and you can be normal, like the tiredness will slowly go. Yeah.
Oh, that's good to hear.
Yeah.
I guess once that tiredness does go, I'm wanting to know how much activity I should do, how much activity is advisable. You know, I'm really worried that if I do too much too soon, that I might have another heart attack.
I completely understand your concern. I think many patients feel this way. I think it's natural to feel this way. I highly recommend you that you join the cardiac rehabilitation program, because this program will help you learn slowly it will help you regain slowly the strength of the muscle. You can regain the strength of your muscle. It will help you, you know, they will guide you through the treatment, and you can learn about the healthy lifestyle changes. Yeah. And so I would highly recommend that you join the cardiac rehabilitation program anywhere, the place where you live, at a nearby hospital. Yeah.
Okay. And besides that, I guess I'm also wanting to return to work. So I work in an office, and I just sit on my chair all day. And I'm wondering how quickly I can return to my job, and if the condition is going to make me an invalid, you know, for the rest of my life.
I completely understand your concern. I know it must be quite hard for you. It's understandable. Normally, most of the patients, they can resume the normal activities after a heart attack. So I can look at your medical records, and I can see that I would suggest you that you can return 4 to 6 weeks. You can return to your work. And yeah. So because there are many, you know, factors that increase the risk of heart attack. For example, high cholesterol, high blood pressure, obesity, lack of exercise, stress. So that's why I'm stressing more on that you should join the cardiac rehabilitation program, take appropriate medication, eat healthy, exercise regularly. Because if you don't follow this, you could develop complications in the future. For example, you could have a second heart attack.
Oh, right.
Yeah.
Okay. Oh, that's really scary. You know, I really don't want to have another heart attack. That's probably my biggest fear.
Yeah.
So anything that you can tell me that I can do to reduce that risk in the future, I'm really, really keen to know.
Yeah, actually, there are many factors that increase the risk for heart attack. As I told, that it could be high cholesterol, high blood pressure. So the main thing is the diet. I would like you to change your diet. Eat like whole grain food, eat more of fruits, vegetables, more of protein. It's a good idea to cut off your sugar, your saturated fat, carbohydrates in your diet. So yeah, because I had a similar patient like you, and after taking this appropriate medication and eating healthy food and exercising regularly, his symptoms have improved dramatically. So yeah.
Thank you. Let's move on to the second role play. This is the information for the second role play. The number is 2 for medicine. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play now, please?
Yes. Hi, my name is Dr. Preeti Tripathi. I'm one of the doctors at this medical center. May I have your name?
My name is Sarah.
Nice to meet you, Sarah. How can I help you today?
Certainly. So I've come about my 5-year-old boy, Matthew. So he went to the emergency department a few days ago, and I've been told that he has asthma. So I've just come today to find out what asthma is. That's my first question.
Okay. So how much do you know about asthma?
Well, nothing much really. It was just what happened on that day.
Okay. So I would like to tell you a little more about asthma. Asthma is a long-term lung condition where a person's airways, they become inflamed, it becomes narrow and swelling, and extra mucus is produced, which makes it difficult to breathe. Yeah. So the common symptoms of asthma could be shortness of breath, and the other symptoms could be like wheezing, coughing, tightness in the chest. The coughing of asthma is very bad, especially at night, and because one cannot sleep because it disrupts the sleep and makes one very irritable and very tired the next morning. Yes. And also the exact causes of asthma actually are not unknown. So it can be triggered by hay fever, chest infections, cold air, animal fur, pollen. Yeah.
Wow. Well, that's definitely true for Matthew. He's been waking frequently at night and coughing, and it's got me a little bit worried. I'm wondering if he's always going to have this condition.
As I said, because it's a long-term condition. Yeah. For at the moment, yes, I can say that it's going to last for long. Yeah. Because he has to take his medications and follow a strict diet and yes, do exercise regularly. It can be managed easily. Yes.
Okay. Well, I guess it's that management that I'm really worried about. So I'm just really worried that he might have a severe attack, and I don't know sort of what to do, just to manage his asthma every day and also in a severe attack.
I completely understand your concern. It's natural to feel this way. Asthma can be easily managed by inhalers, such as salbutamol, and the severe cases of asthma can be managed by long-acting inhalers, and as well as you have to take oral steroids to open your airways. And if you're following the doctor's treatment recommendations, and the symptoms of asthma can be managed effectively. And if you do not follow your treatment plan or you do not have your regular checkups, it might worsen your condition.
I see.
Yes. So I would like you to, I would also give you an asthma action plan, which any asthma attack or in any emergency, you should follow the asthma action plan. And I would also, it's a good idea that you learn as much information about asthma the trigger points, and the asthma action plan. And I also would suggest you that you maintain a diary of events after each episode
Okay.
to identify the things that may trigger your symptoms, your son's symptoms.
Yes, yes, that's right. Okay. I guess is there any other way that that you can help? You know, me sort of manage his asthma. So you mentioned the asthma plan and the medication. Is there anything else that we need?
Also make sure that at his school his teacher knows, and the school always have salbutamol ready in case of emergency. Also I can provide you some pamphlets and reading material about what we are discussing today. Also I can provide you some services that includes like counseling. So that will really help you, you know, to gather more information. Yes.
Okay, that's very, very helpful. Thank you for that.
Right.
I guess, you know, I'm also maybe a bit worried about the running around and walking at night. Is there anything I can do about that?
As I said, like the coughing of asthma is terrible. So with appropriate medications, with some time, it will resolve. But at moment, yeah, it's going to be tough for you and for your son, because he will be waking up often, and yeah, it's going to make you irritable and making him also irritable. So yeah.
Thank you.
Thank you.
That is the end of the second role play and the end. The end of